This is KPIX 5 Breaking News.
Breaking news, San Francisco Mayor London Breed has an update on the city's coronavirus response. Let's listen in.
Kaczynski, people who are consistently working on the front lines to help us deal with many of the challenges that exist as it relates to COVID-19 in San Francisco. As of today, we have 1,754 cases of COVID-19, and sadly, we have had 31 people pass away as a result. Currently, there are 84 people that are hospitalized, and for more information, please visit datasf.org/COVID-19 for details. I want to just start today on a little bit of a lighter note in recognition of so many of the first responders and healthcare workers that are on the front lines doing the incredible work to keep us all safe. And Monday was International Firefighters Day, and I had an opportunity to drop off lunch to our firefighters at Station 6. And just express my appreciation for their work. The firefighters and the paramedics and the people who are called to so many very challenging scenes continue to work very hard for our city during this pandemic, and we appreciate the work that they do. And as we know, in the age of social distancing, they don't have the luxury to socially distance themselves when they are trying to save someone's life, and they still put their lives on the line. So I want to express my appreciation to the firefighters and paramedics in San Francisco. And also today is the one-year anniversary of our fire chief, Janine Nicholson. Got my police and fire chiefs mixed up. Janine Nicholson, she's been on the job for about a year now. Today is her anniversary where she was sworn in. She's been doing an amazing job. And again, I want to express my appreciation to the men and women of the San Francisco Fire Department. And today is also National Nurses Day. And this is an incredible opportunity. I know so many of you have done really amazing things, whether it's coming outside and clapping or singing songs or sending messages to our healthcare providers, as well as our nurses in particular, who are doing the hard work, who are directly in contact with people who have the virus and those who are dealing with a number of other health challenges. And so I want to take this opportunity to especially send a heartfelt thank you to the nurses here in San Francisco and all over the country for the work that you have been doing to help us throughout this pandemic. Those are the real unsung heroes, the folks who have to put themselves on the line, the folks who are asking us to make sure they have PPE so that they can help support the patients that they care so deeply about. So I just wanted to take this opportunity to express our gratitude for your work. I want to talk a little bit about our small businesses. Governor Newsom plans to announce the next phase in the statewide shelter-in-place order tomorrow. And we are working to understand the exact details of what that would entail. And as I said on Monday, it's important that we work hand in hand with the state on guidelines to reopen, but we need to do so responsibly. And what that means is the governor is providing the guidelines for the state as a whole. But the reason why our counties have control over whether or not we implement some of those suggestions has everything to do with what's happening with the facts, with the numbers. How many more cases? How many more deaths? What's happening on the ground in our cities so that we can make good decisions to continue to protect people. As much as I want to see so many small businesses reopening in San Francisco, I want people to get back to work. I want these places to thrive. I want people in San Francisco to have access to things that they know and love. The challenge we will continue to have in San Francisco in particular is making sure that, and Dr. Colfax will talk more about this, but the numbers are still going up. The number of deaths are still going up. And we have not lowered the curve. So we have to be mindful of that, and we have to be responsible when we look at ways to bring various industries back, implementing the kinds of guidelines that are going to continue to limit direct contact with one another. Already we saw in a study that was done in the mission with the number of people who were infected, many of the folks primarily who were infected are people who are essential workers who have no choice but to go to work to make ends meet, and also because they're essential workers. So we want to keep that in mind. The more that people have interactions with other people, the likelihood that other folks will continue to get infected. And so as difficult as I know this has been, we need to keep that in mind when making decisions about reopening. And so I'm really excited that we've allowed construction to occur in our city. It's not only important for the job opportunities for those who work in construction, but it's also important for the desperately needed housing that's under construction in San Francisco. In time for Mother's Day, the flower shops are able to provide deliveries just in time to send your mom or your loved one or someone you care about for flowers, or just maybe order some for yourself. The things that we are doing to try and get these businesses open, we will continue to use facts, use data, and get them back in business as quickly as possible. And I will tell you, we are working very hard to come up with the kinds of guidelines that will continue to protect public health. This is really a long-term plan. The fact is, without a vaccine, we are going to be living with concerns around the COVID-19 for months to come. And so it's time that we started getting creative and providing solutions and making sure that we're working around that while still allowing people to open their businesses and to make sure that our economy is not even more damaged than we know it will be as a result of this. And so we will continue to work with the Department of Public Health to make good decisions about how to get our city going again. And it's going to take time. It's going to take patience. I know we're asking a lot of all of you, and I just want to again express my appreciation to so many of you who have followed the order and done your part, and it's definitely appreciated, and there is additional support in that arena needed as well. I also want to express my appreciation for what has been happening in Dolores Park in particular. We know that there were some challenges this past weekend, in Sunday in particular, and as a result of the announcement that I made on Monday, people are following the rules, and we've been monitoring the park along with other parks and other areas in the city. And we want to really express our appreciation. Today is a beautiful day. I'm not suggesting you go out and have a picnic and meet with your friends. Those things are prohibited. And we know this weekend is probably going to be nice. So when enjoying the park space and the fresh air, please, please, please make sure that you are only doing it with the people who are part of your household, and you maintain 6 feet distance from all other parties, and you don't invite friends in to have a wine party or a picnic or anything of that nature. This is really about making sure that you have the benefits of our parks, but also we have to be very, very careful because the coronavirus is here in San Francisco and people are impacted, and this is the last thing that we want to see happen as a result of our hard work and maintaining our distance for all this time. So please continue to follow the order. We will be monitoring Dolores Park and other hotspots very, very carefully, and if necessary, we will make a swift decision if we see that the park is overrun in a way that we can't necessarily control it. It's for your own safety. So thank you again for your cooperation so far, and please continue to follow the order when enjoying our parks. Today, I want to just announce a plan, and Jeff Kaczynski, who is here from the Healthy Streets operation team, will talk more in detail about it, but they have been very, very hard at work. Many of you are familiar with the Healthy Streets Operation Center, which is HSOC, and it's a part of a group that spans various city agencies where we work with the homeless outreach team, the HOT team, we work with the San Francisco Police Department, we work with the Department of Public Health and a number of other organizations in order to address the challenges with healthy streets in San Francisco. We know that continues to be a challenge, but the reason why we've been able to make gains before this pandemic had a lot to do with this team of people who are working collaboratively to address the challenges on our streets. And so the Human Rights Commission, under the leadership of Cheryl Davis, created a Tenderloin Community Roundtable with stakeholders from the neighborhood, and they came up with a comprehensive plan. Part of what they wanted to do, like they've done, as we said, we embedded in our Emergency Operations Center here in Moscone a team that focuses on equity and underserved communities. And as a result, what the Human Rights Commission has done, along with a number of other community volunteers and folks, they would go out into neighborhoods like the Tenderloin, like the Bayview, like the Western Addition, pass out food, pass out masks, educate the public about coronavirus and challenges, make sure people know how to get testing or other resources. Again, these are a group of people, a lot of volunteers, a lot of people from the community who are putting their lives on the line to really support and serve the public and to make sure that no one is left out of the equation. And what they noticed, the biggest challenge was, of course, sadly, the Tenderloin. And so part of the work that came to be as a result of this roundtable, they distributed thousands of face coverings in this community. They partnered with Code Tenderloin and the Boys and Girls Club to distribute computers to youth in the community and identify where we need to put internet hotspots so that kids are they don't fall behind in school. They mobilized community resilience caravans with the police department to remind people about the importance of social distancing, and they distributed face coverings, and they educated people on the fact that you don't need a mask. You can also have something that's a face covering like a scarf or some other thing to cover your nose and your mouth. They distribute learning kits and books and activities to youth and their families, in the Tenderloin. So they've been hard at work, but we know the conditions remain particularly challenging. And we've sadly have seen a significant increase in the number of homeless people who are on the streets, which is concerning from both the health of those who are unsheltered and for the health of the residents who live in the community. So to address these challenges, we've developed a plan for responding to the issues of the Tenderloin on a block-by-block basis. Now, this plan was informed by on-the-ground assessments of the Tenderloin and numerous meetings with members of the community, nonprofit organizations, and businesses in the area. And to start, we identified 13 blocks that are our first priority. And as I said, Jeff Kaczynski will talk a little bit more about that in detail. And I want to really recognize the hard work of everyone who participated. The conversation centered around the need to, of course, clean the sidewalks, clear the sidewalks, have sufficient trash, have access to resources, make sure that there are the streets and the community is a lot more safe, especially because there are a lot of children and elderly people who live in the Tenderloin. And so this is a conversation that has been happening for a very long time, and before the pandemic, and has gotten even worse since. And I want to really recognize that this is going to be a targeted plan. It's going to be a challenging one, and we are set to be as aggressive as we can with implementing it so that the people of that community can notice and see a difference. Thanks to Urban Alchemy, we have some community ambassadors that we're bringing on board on a part-time basis. Those are the people that you see who are oftentimes managing the restroom facilities. They are familiar with people in the community, and I want to thank them for their hard work and their dedication because they are showing up to work every single day in these very challenging communities, again, putting their lives on the line. I want to also thank the Department of Public Works and what they do every single day, cleaning up feces and needles and urine and trash. And I know on Monday I expressed a lot of frustration because as much resources as we continue to invest in the Tenderloin, and as much work as a lot of people are doing to keep that place clean and accessible to folks who live there, it still continues to be a challenge, and we need to hold everybody accountable. Everyone has to be held accountable. It's not just the city's responsibility. It's the people who are a part of that community, whether they are housed or not. We all play a role in protecting and serving and supporting this particular community, and that is our commitment in outlining a plan that specifically looks at 3 of the most challenging blocks and puts into place a system that will allow for regular cleaning, trash pickup, food service, trash cans, restroom facilities, wash stations, water, just some of the basic things. And we'll continue to also, through the hotels we provide, ensure that they are available to some of our most vulnerable populations. And just a reminder that before this pandemic, we've had thousands of people who were homeless, who were in our system of care. And those will be the people that will be prioritized with any service that we make available, because we want to make sure that the folks who have been waiting the longest, in many instances, they are oftentimes the ones who are skipped over for services and support. And we need to do a better job at making sure we stick to this system and we prioritize the people who have been in our city before this pandemic so that they get the support and services that they need. So with that, I want to thank all of you again for your cooperation and continue to the best of my ability, because I got to tell you, this staying at home thing is rough for me too. At first I said it with a lot of enthusiasm, and now probably not as enthusiastic as I've asked in the past. Nevertheless, it is necessary. And I want to just remind everyone how important it is so that we can keep our public health intact, we can keep people safe, and we will continue to do all we can to provide resources and to make sure that as soon as we can, we get our economy going and we provide an opportunity for our business community, especially our small businesses that are struggling to open and operate. So thank you again for your patience and your cooperation. And now I'd like to ask Dr. Grant Koufax to come forward and provide us with an update.
Thank you, Mayor Breed. Good afternoon. I'm Dr. Grant Koufax, Director of Health for the City and County of San Francisco. Before beginning my coronavirus update, I would like to thank the thousands of nurses in the Department of Public Health and throughout the city for their dedication and courage as they continue to serve patients and our community during this unprecedented pandemic. This is National Nurses Week, and it couldn't come at a better time. All of San Francisco's nurses are demonstrating the utmost professionalism, compassion, courage, and heart, as they always do. I personally give thanks to the nurses in our public health system at Zuckerberg San Francisco General Hospital, at Laguna Honda Hospital, our many health centers, public health centers across the city, including Southeast Health Center, Maxine Hall Health Center, Chinatown Health Center, Castro Mission Health Center, and City Clinic, for their provision and care of services for communities across our great city. You provide medical care, but you do so much more. You provide comfort, emotional support, advocacy, and frankly, whatever it takes to help patients and their families. You get it done. I know this from my own personal experience, from working in the emergency room at Zuckerberg San Francisco General Hospital, the inpatient units at that hospital and across the city, including at the VA and UCSF, to our clinics throughout the city. Nurses are the backbone of our system, a system that requires the skills and wisdom of the nursing profession now more than ever. All of us in San Francisco owe nurses a debt of gratitude that grows every day. You are true heroes. We would not be where we are today, making the progress in the fight against the coronavirus without your steady hands, warm hearts, and brilliant minds on the front lines. Thank you. Thank you. Now, with regard to where we stand with coronavirus in San Francisco. Today, there are 1,754 San Francisco residents with confirmed cases of COVID-19. And sadly, 31 San Franciscans have died of the disease. My condolences to their families, their friends, and their community. I would also like to provide an update today on a few aspects of our progress and where things stand in the fight against the coronavirus. I want to start with the issue of testing. As of today, 27,334 people in San Francisco have been tested for COVID-19. And over the last period of months, 8% on average have tested positive. We are continuing to strive to reach our goal of universal access to testing for all San Franciscans. As we announced Monday, we now provide free universal testing for all essential workers, regardless of symptoms or potential exposure. And today, at Laguna Honda Hospital, we are starting our routine testing at nursing homes of both staff and patients. And fortunately, we have already seen a significant uptick in the number of tests conducted across the city. 700 people were tested yesterday at the City Test SF site alone, in the largest day of testing since we opened that service. I am glad that people are starting to take advantage of this option, but we can still do more. And indeed, we must still do more. If you have been showing up to work during the stay-at-home order, you can now get tested and tested for free. There are several options now for testing, including your own healthcare provider, the 2 city test SF sites, and the 4 Department of Public Health community test sites. These sites are open to healthcare workers, first responders, grocery clerks, construction workers, drivers, childcare workers, workers at outdoor businesses, and others who continue to leave their homes to serve the community during this pandemic. Please call 311 or visit sf.gov Get Tested SF for more information and to see a map of all the test sites in the city. We know that essential workers are more at risk because they interact daily with other people and cannot easily maintain social distancing by staying at home. In fact, a recent study by UCSF in partnership with the Health Department and the Latino Task Force reinforced this fact. The study found that workers tested in the Mission District had a higher rate of positive results than residents, and that many of these workers were asymptomatic. This is why getting tested, regardless of symptoms, is key to our response. And this is why we are moving forward in our vision for universal access to testing for all in San Francisco. We need to do everything we can to support workers in all aspects of health and safety during the pandemic. This includes access to testing, but it also means support for successful isolation and quarantine so that people can get well and limit the risk of exposures to members of their households. We are committed to working with communities to better understand the type and kinds of support that people need. The expanded testing is a step in the right direction, an important step in the right direction, and I encourage all essential workers to make use of it. And as we test more people, we naturally expect to find more cases. So this added resource is very important. Expanding testing is a key piece of our recovery plan. And now I would like to review other major elements we have in our plan. I want to make sure that everyone in our community knows how much we are measuring our readiness to open, how much and how. Now, as much as I want, and I think everyone wants, reopening to happen, we must continue to follow the science, data, and facts. Remember, the virus is still out there, and it thrives when we get together and socialize. We should celebrate our progress and the fact that we have saved lives across the Bay Area and the state. We have truly saved lives. For instance, our mortality rate in San Francisco is 1/4 of that in New York State. And our mortality rate in San Francisco is half of the California state average. And yet, we must also recognize that we are still very much in the midst of a pandemic. It is not over yet, not by a long shot. The virus doesn't have a timeline. It was here in February, it was here in March and April, and it will be here in the summer and fall and beyond. And the more people move around, the more contact they will have with others, the more likely it is that the virus will spread. It is highly contagious. We know that there is more virus out there than ever before, and there are still outbreaks in our community. We remain focused on protecting the health of the most vulnerable populations, those who live in congregate settings, and people in communities at highest risk of transmission and poor health outcomes. In the Bay Area, we will be watching 5 key indicators to track our progress. They are that the number of patients in the hospital with COVID-19 is low and flat or decreasing for a sustained period of time. Number 2, that we have enough personal protective equipment, PPE, for all our healthcare workers to respond. Number 3, that we have expanded testing to meet the need, especially for people in vulnerable populations, essential workers, and communities that are affected by health disparities. And not only that testing is expanded, but we have the wraparound services to support individuals and their families in the event that they test positive. Number 4, that we have the capacity to investigate every case of COVID-19, to trace each person's close contacts, and to isolate and quarantine the people who need it. And number 5, that we have the ability to measure the rate of new cases of COVID-19 to determine whether it is decreasing, staying flat, or increasing. This will take ongoing efforts as we are still building our surveillance systems across the Bay Area with the help of scientists from UCSF, the Chan Zuckerberg Institute, and Berkeley. I know that there is a lot of excitement and hope about reopening, and I personally look forward to that too. And yet, we must hold steady and let the data guide us. We must maintain our gains. Otherwise, the virus will quickly outrun us, and a surge will occur. And at the same time, we cannot lose sight of the fact that life will be better in May. Right now, outdoor activities and businesses can resume with proper precautions. This is going to improve our lives and our outlook. I notice, too, that surveys show that the vast majority of the public want to continue our restrictions to keep themselves, their family, and their communities safe. They know how important it is that we slow the virus's spread. The vast majority of the public support public health measures to slow the virus down. And at the same time, I recognize that San Francisco residents and businesses have made tremendous sacrifices to flatten the curve and protect community health. We must continue to work together so those sacrifices don't go to waste. We will keep watching the indicators and working with our region and the state on the most reasonable next steps. Reasonable and responsible and driven by data and science and facts. There have been many questions this week about the governor's plans and their impact on San Francisco. Let me clarify. The San Francisco and Bay Area health orders currently in effect through May do not permit curbside pickup from non-essential businesses. The governor's guidance to retailers coming out Thursday will spell out the state's expectations. We will study those very carefully. However, it is important to remember that the rule of thumb is whichever order is more restrictive is the order that will take precedence going forward. We are working, and my team is working very hard to help find ways to reopen more businesses and activities safely while sustaining the progress we have made. We are developing careful, stepwise approaches, working to mitigate risk and protect the public health as much as possible. We are partnering with the Mayor's Office of Economic Workforce Development to ensure that the voices and ideas of local businesses help craft this next phase. We are hoping some pilot programs can go into effect this month, but these will be with considerable restrictions to ensure safety. Now, I want to add a few remarks to the announcement of a block-by-block plan to address the issues in the Tenderloin that are impacting the quality of life for residents in that neighborhood. Jeff Kaczynski, manager of the Healthy Streets Operations Center, or HSOC, will provide more detail in a moment. But I want to highlight the health department's support for and participation in this critical work. The health of the Tenderloin community has been and continues to be a priority for us. We operate a primary care clinic there and have a long-standing relationship with the community and our patients. We have participated in HSOC since the beginning, and the health department provides outreach, street medicine, overdose prevention and opioid treatment, harm reduction, and environmental health services to protect the health and safety of the people in the Tenderloin who are experiencing homelessness and those that are housed. The Tenderloin is a vibrant community of families, merchants, artists, restaurants, governmental, and civic organizations. I know that the coronavirus emergency has made life harder for the Tenderloin. The department is committed to partnering with other city agencies and communities and business organizations to help improve the situation. Our community health response team and street medicine teams are on the front lines and expanding their outreach efforts and helping people protect themselves from the spread of the coronavirus. Our environmental health inspectors conducted an initial assessment of the areas identified in the plan, which helped to form the basis of the report. These inspectors will continue to provide input and guidance on interventions that may be necessary in the neighborhood to protect against rapid spread of the coronavirus. And now, Jeff Kaczynski will further describe the goals and activities of the city's plan to support this important community. And I would like to personally thank him for his leadership in this effort. Thank you.
Good afternoon. My name is Jeff Kaczynski, and I'm the manager of the Healthy Streets Operations Center. HSOC is a multi-departmental collaborative that was stood up to address unsheltered homelessness and related street conditions here in San Francisco. Before I start, I want to thank all of the frontline outreach workers involved in HSOC, the HOT team members, paramedics, police department, public health outreach workers, public works employees, and the nonprofit partners who are every day are out in the streets working with our unsheltered individuals and people who are struggling on the streets to help them shelter in place in a for people who actually have no shelter. It's challenging work. They're putting their own health at risk by doing this work, and it is such an honor and a privilege to have the opportunity to work with them. Also want to thank the staff who are working behind the scenes, both at the Department of Emergency Management, the dispatch workers and police officers who are there helping guide the efforts of the frontline staff, as well as our small but mighty team here at the Emergency Operations Center, many of whom helped work on the plan that I'm going to talk about today. Clearly, the challenges of unsheltered homelessness have grown exponentially during the COVID-19 crisis. Prior to this crisis, we already faced challenges with not having enough shelter and affordable housing to meet the needs of our community. Mayor Breed had been working tirelessly and continues to work tirelessly on this issue. But this pandemic has forced us to thin out the shelters, and it has also required that we follow the CDC guidance to not disrupt homeless encampments. And whereas that is a challenge for some, I just want to point out that many of the fantastic results that we've had here in San Francisco that Dr. Colfax spoke of are because we're following these guidelines. Nonetheless, this has created challenges in our community and some pretty jarring numbers. In 2016, August of 2016, we estimated that San Francisco had about 1,200 tents on our streets and in our public places. By April of 2019, that number was below 400. I believe it was about 385. Recently, we did a count in April of 2020, and there were close to 1,200 tents again in the city and county of San Francisco. The Tenderloin is by far the most impacted and hardest hit neighborhood in this current situation. There's over 300 tents in the Tenderloin, 20 large encampments, and that's an increase of almost 300% since just January of 2020. This has had negative impacts on public health and on public safety in the neighborhood, and this is not acceptable. The Tenderloin is a special neighborhood. It's home to many low-income families and individuals, to formerly homeless individuals, to many seniors, to families and children, to people with disabilities. It also hosts the second largest African-American population in the city, multi-generational households from Yemen, Latin America, the Philippines, Vietnam, and other regions. It was the center of tenants' rights and LGBTQ activism in San Francisco. And the neighborhood has dozens of historic businesses. It's also the densest neighborhood in San Francisco, and it's also a place where open-air drug dealing, drug sales and use, sex work, and homelessness are acute. While this neighborhood has its challenges, it's also one of the most vibrant and one of the most loving neighborhoods in San Francisco, and its residents deserve better than what is happening there right now. The urgency of this comprehensive plan that I'll speak about in a bit has been driven through a lens of human dignity, of equity, of public health, and of public safety. And it is a high priority for Mayor Breed, who instructed the departments a few weeks ago to put this plan together, and it is been a high priority.
And you just heard the latest from San Francisco officials. The mayor announcing a total of 1,754 confirmed COVID-19 cases in San Francisco and a total of 31 deaths. Of the more than 27,000 tests conducted so far, an average of 8% of those tested positive. City leaders also talked about a safety plan for the Tenderloin after complaints of drug deals and encampments. 13 blocks have been identified as a first priority for officials. City leaders are also keeping an eye on Dolores Park to make sure crowds do not gather there. To continue watching the news conference, head to CBSN Bay Area on KPIX.com. Thank you for watching. Now back to your regular programming.